What if I told you could have $1 million saved or more and still qualify for thousands of dollars per year in health insurance subsidies? Seriously, a millionaire getting help paying for health insurance. Sounds crazy, right? Because most people assume if you have money, you don't qualify for anything. But here's the truth. The Affordable Care Act doesn't care how much money you have. It only cares about how much money you show on paper. And that's what today's video is all about. Today we're diving into one of the most powerful and misunderstood retirement plan strategies out there. We like to call it the Broke Millionaire Strategy. And it can help retirees, especially early retirees, qualify for ACA healthcare insurance subsidies before Medicare begins at age 65. Now, quick favor before we jump in, if you're retired or planning on retiring soon, or you've ever wondered, how am I going to afford health insurance before Medicare? Go ahead and hit that like button, subscribe to the channel, and comment the word ACA down below. It helps more people find this video because this topic could save families tens of thousands, $15,000, even $20,000 per year in healthcare costs. All right, let's get into it. So first, what exactly is the Broke Millionaire Strategy? The idea is simple. You can be a millionaire on paper. You can have $500,000, $1 million, $2 million, $3 million or more saved in retirement accounts or investment accounts in real estate, but you intentionally keep your taxable income low so that you qualify for Affordable Care Act subsidies. In other words, you're not actually broke, but on your tax returns, you look income broke. That's why it works, and this strategy matters most for people who retire before age 65, because at 65, that's when Medicare begins. But between retirement and Medicare, there is a gap, a dangerous gap, a very expensive gap, and without planning, that gap can cost you tens of thousands of dollars. Now, let me give you an example. A couple retires at age 60, they're too young for Medicare. So they go to the ACA marketplace and they see premiums like $1,000 or $1,500 per month, $2,000 per month, even $2,500 per month. That's $18,000, $24,000, or $30,000 per year just for health insurance. And that's just before copays, before deductibles, before prescriptions, before anything else. But with ACA subsidies, that cost could drop dramatically, sometimes by half, sometimes even more. That's why this strategy is so powerful, and that's why we're talking about it today. Now, here's the big misunderstanding. The Affordable Care Act does not look at your net worth. Let me repeat that. The Affordable Care Act, or ACA, does not care about how much money you have. You could have a paid-off house, $2 million in your IRA, $800,000 in a brokerage account, rental properties, business equity. None of that automatically disqualifies you because ACA subsidies are based on one thing, income, specifically a number called Modified Adjustable Gross Income, or MAGI. That's the number that determines whether you qualify and how much you get. So the game becomes not how much money do I have. The game becomes how much income am I showing? Because retirement isn't just about how much you've saved, it's about how you take it out. There are some income thresholds you need to know. So let's talk about these key thresholds. ACA subsidies are based on your income, compared to something called the Federal Poverty Level, or FPL. Every year, the government sets the poverty guidelines, and the ACA marketplace uses those guidelines to calculate subsidies. The general idea is the lower your income, the more subsidy help you receive. The higher your income, the less help you receive. So the ACA looks at your income as a percentage of the federal poverty level. Here are some key ranges. 100% of the FPL, or federal poverty level, there's 150%, 200%, 300%, and 400%. Now, historically, subsidies disappeared completely above 400%. That rule has been adjusted in recent years. But still, higher income means less subsidy. So let's use an example. Married couple, household of 2, the poverty level is roughly around $20,000. So that means 150% is around or about 30,000, 200% is 40,000, 300% is about 60,000, 400% is about 80,000. So what does that mean? It means if a retired couple can keep their modified adjusted gross income around $40,000 to $60,000, they may qualify for very meaningful subsidies. But if their income jumps to, let's say, 100,000 or 120,000 or more, those subsidies may shrink or disappear entirely. That's why income planning matters so much, because the difference between 60,000 of income and 100,000 of income could literally be $10,000 to $20,000 in healthcare costs a year. Now, that's not a small detail. That is a retirement changing detail. Now, what income counts towards the Affordable Care Act or modified adjustable gross income? Now, this is the most important part of the entire video, because not all income is treated the same. The Affordable Care Act uses what's called as the modified adjustable gross income. So what counts? Let's walk through it. Number 1, wages. If you work part-time, that counts. Number 2, self-employment income also counts. Number 3, traditional IRA withdrawals. If you take $50,000 from your IRA, that's $50,000 of taxable income added to your modified adjustable gross income. Number 4 is 401k withdrawals. Same thing. Number 5, pension income fully counts. Number 6, interest income, even if you don't touch it, still counts as income. Number 7, dividend income, even if it's reinvested, can count. Number 8, capital gains. If you sell investments and create gains, that counts. Number 9, rental income. Net rental income counts. Number 10, Roth conversions. This is one of the biggest traps if you convert. $100,000 from an IRA to a Roth, that is $100,000 of income shown on your modified adjustable gross income, even though you didn't spend it. So even though you didn't buy anything, even though the money is still yours, it counts. So Roth conversions must be handled carefully, especially during the Affordable Care Act years. And then Social Security sometimes counts, depending on the total income. So when people say, I'm retired, I have no income, that's often not true, because withdrawals, gains, conversions all create income. So what does not count as Affordable Care Act income or income when we calculate your modified adjustable gross income? So here's where the strategy comes in. Some sources of money do not raise your modified adjustable gross income. And that's where the Broke Millionaire Strategy lives. For example, qualified Roth IRA withdrawals. If you pull money from your Roth correctly, it's tax-free and it does not increase your modified adjustable gross income. That's pretty powerful. Another example, return of principal. If you sell an investment, but most of it is principal, only the gain counts towards your income, not the whole amount. Another example would be an HSA withdrawal for medical expenses. That does not get counted as income. One other example, pulling from cash savings. That's not income. And in some cases, properly structured life insurance loans are not taxable income. Now that's advanced planning, but it's part of the conversation. So the key point is the ACA doesn't ask how much can you spend. It asks how much income are you showing? Big difference. Why the strategy matters before age 65. So why is this so important, the strategy before you turn 65? Well, the reason is once you hit 65, Medicare begins, and ACA subsidies no longer matter. But between retirement and Medicare, those years are critical. Ages 55 to 65 are some of the most expensive healthcare years of your life. And if you retire early, you may have 5, 7, 10 years before Medicare comes in. So planning for those years is essential. The Broke Millionaire Strategy is really about bridging the gap, keeping healthcare affordable while protecting your long-term retirement plan. So how do we structure all your income to stay under the ACA thresholds? Let's get practical. What are the solutions? How do retirees actually do this? Let's walk through several strategies. Strategy 1, you could use your Roth accounts early. Not usually talked about because we always say you should defer your Roth money to be used as the last pot or the last bucket to be used. Now, if you have Roth money already, this is gold because Roth withdrawals do not increase your modified adjusted gross income. So if you're trying to figure out what this gap or how to fill this gap to get to 65, you could use this to use a Roth account to help give you income, but still bridge you and save you thousands of dollars. So a retiree could spend, let's say, $40,000 from a Roth, $20,000 from taxable principal account, and show very little income. That keeps subsidies intact. That's why having Roth diversification is so valuable. Strategy 2 is live on your taxable accounts first. Many retirees do better drawing from their brokerage accounts, cash savings, principal, before touching IRAs, because IRA withdrawals are fully taxable. Taxable accounts give you control. Only gains count, not the full withdrawal. Now, I understand this can be a little hard because psychologically, it's really hard for people to go grab from their savings or their after-tax accounts before grabbing from the IRAs. There's a little bit of a mind shift or psychological shift that you'll have to help turn there. And then strategy 3 is control your capital gains carefully. Now, this is a big one. Let's say you sell $50,000, but only $5,000 of that is gain. Only $5,000 now counts towards your modified adjusted gross income. So investment sales can be managed strategically to avoid income spikes. Strategy 4, delay Social Security. Taking Social Security early adds income. Delaying Social Security can help keep your modified adjustable gross income low, and it increases your future benefit. So delaying can be a double win. Be careful with Roth conversions. Roth conversions are powerful, but they can be dangerous in the ACA years or the gap years. Convert too much and you lose those subsidies. So conversions must be coordinated up to a certain threshold, but not beyond. This is where professional planning is essential. Strategy 6, create an income buffer. Many retirees set a target. For example, keep your modified adjustable gross income around $55,000. Avoid jumping above $80,000. That buffer can mean thousands of dollars in a subsidy difference. Strategy 7, structured dividend and interest income planning. Now, some retirement strategies focus on reliable income, and that's great. But that can be, you have to make sure that it's structured efficiently. Not all dividends are taxed the same. Qualified dividends may be taxed at lower rates. Interest strategies may create spendable income without triggering massive modified adjustable gross income spikes. This is why retirement income planning is not a one-size-fits-all. Now, there are some pros and cons to the Broke Millionaire Strategy. So let's be honest. The strategy is powerful, but it's not perfect. Let's cover the pros and the cons. All right, let's start with the pros. Number 1, massive healthcare savings. Subsidies can save $10,000 to $25,000 per year. Number 2, more flexibility. You control income. And then number 3, tax optimization. Low-income years are ideal. Number 4, bridges the Medicare gap. All right, now let's talk about the cons. Number 1, requires careful planning. One wrong withdrawal can wipe out all the subsidies. Number 2, Roth conversions become tricky. Number 3, ACA rules can change politically. And number 4, not everyone qualifies equally. Lastly, number 5, tracking modified adjustable gross income requires effort. So this is not a DIY strategy for most retirees. It definitely needs some coordination. Now, who should consider this? This strategy is best for people who want to retire before age 65, have significant assets, but want low taxable income or show low taxable income. They have a Roth or taxable flexibility, want to reduce healthcare costs, and are willing to plan withdrawals carefully. If that sounds like you, this could be one of the biggest hidden retirement levers available. Now, here's the big takeaway. You can be a millionaire and still qualify for Affordable Care Act subsidies because ACA is based on income, not wealth. The Broke Millionaire Strategy is about structuring withdrawals, keeping MAGI under control, bridging the healthcare gap, and saving thousands per year legally. Now, if you want help building a retirement income plan that includes ACA subsidy optimization, tax smart withdrawals, reliable income, and confidence through age 65 and beyond, here's what to do next. Make sure to click the link in the description to schedule a complimentary retirement income review, or comment Broke Millionaire below, and we'll send you the next resources to explore. And make sure you subscribe, because in the next video, we're covering the Roth conversion trap that costs retirees $15,000 or more and lost Affordable Care Act subsidies. Thanks for watching. I'll see you in the next one.